This is Ojok Markoline, BIS graduate at the University of Sacred Heart Gulu. During this COVID period, I was really scared, and when I looked into the way the virus has been spreading through the use of papers, when people touch materials that have been contaminated, I was really moved in that I looked into the direction of how can we best eliminate the spread at a lower level. So as per the requirement to attain a bachelor degree in information systems, I looked into a project called of patients management in hospitals, low-cost hospitals. So I developed a system that enables patients to get access to hospital facilities without them moving around with papers and other things. Because you all know the virus can get spread through contact with materials that have been contaminated, like papers, metals, and all that. So this system is given to low-cost hospitals because out there we have patient management systems, but I looked into how can we best also help the people who don't have a lot of money, like the health centers and all that. So this system assigns the patient a unique code during time of registration. So this code, they can use it to access patient services. They can go to the doctor, the pharmacist, the laboratory, and other part of the hospital. It's a user-friendly system that I would like to show you how it works. I'll take you through a screen recording of how the system works.
Here is the patient management system that I've developed. We have the login screen, username, the login roles, and then the password. For the admin, we are using the root, which takes us straight to the administrator portal. We'll see the administrator creates the users, has access to employees, and also creates patients and views some bit of statistical data. We see that even the users have a unique code. So the patients also have a unique code that is generated from the total number of patients available and then the date. So this is the number that the patients carry on to enable them access the services of the hospital. So you don't need to carry a paper with your name and all that. All you have to remember is just the patient code, and your details will be available to you in time of need. We'll see that in other interfaces we also have a link or a sync between the different portals using the patient code. So for creating a new drug, for accessing drugs with the pharmacist, the patient code will be used to generate some of these reports. When you go further, the doctor's portal, we see that the doctor creates patient history, and during this process he has to also load the patient details using the patient code. And when this is loaded, you can fill in other details that the doctor notes and other options available, as you can see here. We also see that, that we have the referrals, where you have people who have been referred to hospital or people who are referred to go to other hospitals. The details are kept. And the help function enables the users to email the developer in case of any inquiries. When you go to the next interface, we'll see that with the receptionist, he or she is able to create patients using the patient code. As I said earlier, the receptionist also creates appointments for the doctors and for the laboratory technicians, creates also referrals, and then the billing. So most of the work is done by the front desk or the person who is at the front. Here we have billing because where I did my research on good of medical services, the receptionist does the billing. So they have the billing portal embedded within the receptionist. So this is just to simplify the work and also make fewer to reduce on the cost of acquiring more computers. So if we have other interfaces synced, It makes it easy. Now with the pharmacies, we see the pharmacies also assigns drugs based on the doctor's report. He or she also adds new drugs to the database for easy follow-up. We have the referrals here also. We have the help feature. So this is just a simple interface for a low-cost hospital to also computerize the information, to have the data stored electronically, so they don't have the fear of losing the data or maybe getting banned or something like that. And this is the laboratory technician. We have the test, where the tests can be done and details are fed here, and they can also be printed. So this printing is just for records keeping, so that in case someone wants to keep a track of what they'll be tested for, they can generate for them this paper report. This is what